that is taking care under the universal health coverage. We would not dwell so much into it, but then these are all qualities of it. Affordable, because if you are paying a premium monthly, it will do you good if you now want to do, if let's say you are mata, go to hospital, say you want to born, and it's becoming difficult, they want to do CS. In some hospitals, in some parts of Nigeria, you pay up to 500,000. It's a fact. In some hospitals, depending on the level. So if you are not buoyant at that time, you have to go and borrow. It's no longer affordable, right? So these elements are what the National Health Policy is looking at. Now, coming down, the Strategic Health Development Plan goal is to ensure healthy lives and promote well-being of all citizens of Sokoto State across all ages. We shall come to what that means in a jiffy. The National Health Act, that's the meaning of that, right? NHA, National Health Act, established a national health system which is mandated, among others, to provide for persons living in Nigeria the best possible health services within the limits of available resources, and to protect, promote, fulfill the rights of all persons to access health care services, right? Talking about Section 11 of the National Health Act, it provides for this. At the beginning, when we were listing out in the table of contents, I asked us, how many of us, I wanted to ask a question and say, okay, what do we understand by Basic Healthcare Provision Fund? How many of us have heard of that before, apart from the Ministry for Health? Basic Healthcare Provision Fund. No show. Okay. So, this is the definition of it, right? The National Health Act, in trying to achieve this universal health coverage, right, made this provision, right, provided for basic health care provision, a situation whereby the government would remove 1% of its earnings, consolidated revenue, and set it aside for the provision of basic health care. That is why the name is Basic Health Care Provision. Then fund, it creates a pool whereby it will put that money. And there are still other sources where money will still come into that pool, right? So it's not just, and the beautiful thing is that that program is so much so that the health that you access from there is provided FOC, free of charge. How many of us are aware? You are aware? Okay. So I'm telling you today, those of us in the villages, in the communities that need health, all we need to know, all we need to do. I'm glad that Sokoto is here. So in the end, they will have a lot to say. They will tell us how the citizens can benefit from that basic healthcare provision program and what we need to do on our own to qualify to access those services. Very key and very important.